Hello, I'm Dr. Guy Yatros from Dental Sleep Solutions and DS3 Software, and I'd like to talk to you today about making a mandibular advancement device for an edentulous upper patient. We can do this very effectively. I do this maybe every other month in my practice, and it can be a very effective treatment. And we have a pretty quick way to do this very predictably. So again, the patient has lower teeth, but we're going to make a device that, in my judgment, is best done put right to the patient's ridge. That way, any adjustments made to this mandibular advancement device we can make to the device. Another way we could do this is make it over the denture, but then we may negatively affect the way that denture fits and have to adjust the denture because of the forces we put on it. So we can end up with either a dorsal design, which is my preference, the ones I've done the most of, that'll be made something like this, right to the ridge, and then the lower, of course, will be made on the teeth. Or we can also do a herps as well, and I'm going to show you some slides on how to do this in just a few moments. And this can be done with maybe an extra 45 minutes to an hour for the patient, and a lot of this can be auxiliary time. My staff can do a lot of the preparation that we have to do prior to taking the impressions and the bite on these patients. You're going to need a few things to do this. First of all, you're going to need a denture duplicator. This is the thing that really saves the time, and I'll show you in the slides on how to do this. And it's a way to quickly replicate the denture, so it has a place to put impression material on both sides, and I'll show you how to duplicate the denture with this. You'll need some, we recommend alginate instead of polyvinyl or something because of the cost, because you're going to have to fill this full of impression material, and alginate's a lot more cost effective. You're going to need a vibrator, and you're going to need some ortho acrylic to vibrate into the impression that you're going to make. And the clear, I think, works better so that we can see how well the denture is fitting. You might need some Vaseline to keep these two pieces from fitting together. A torch, and what I didn't have around here was a green stick compound or something to border mold. If you like to do that for your dentures, you may want to have that out as well. And then we prefer light body impression material. I'm going to show you as we reline the duplicate denture. So what we're going to do is duplicate the denture, and then we're going to use that just like the patient's teeth. But after we duplicate the denture, we're going to take a wash impression in there with that. So you're going to need a bowl to put this in. The big old rubber bowl works well to mix up the acrylic, and you'll need an acrylic burr, as you can see here. So not that much stuff. We don't have a full dental office, and if we're going to do this in one of our satellite offices, you can see we can pack all this stuff up to go. So that should take care of everything that we need. I'm going to show you now some slides on how to do this in your office. Again, once you learn how to do this, you can train your auxiliaries to duplicate the denture, and this can be a very predictable treatment and help some patients out who otherwise may not be able to have a mandibular advancement device for obstructive sleep apnea. Thank you.
All right, here you go. Here's how we make a mandibular advancement device for a patient with no maxillary teeth. We start with our denture duplicator, and we typically will have the patient come in about 45 minutes to an hour before we would normally start an appointment, because we go ahead and duplicate the denture while they're there. And that can take a half hour for really quick, 45 minutes or so. And again, most of the time, once you do this a few times, you can train your staff to do it. And it's just something the auxiliaries can be doing, and the patient's reading a magazine while you're duplicating the denture. So we've got our denture duplicator, we've got a denture. Hopefully it fits fairly well, but as long as it fits decent enough, we're going to reline this anyway. So you start by mixing up enough alginate, and it takes typically about 4 scoops, I've found, 4 to 5 scoops, and you make it a little bit wetter than normal, and you fill one side of this denture duplicator, and then you sink the denture down into it a little bit more than halfway, as you can see, and kind of shake it as you put it in there. Wait till the alginate is set, and then we're going to take some Vaseline, and Vaseline the alginate in particular. That's the main thing. We don't want the two sides of the alginate to stick together, and it doesn't hurt to put a little bit on the denture as well, but make sure we go all around the borders and of where the alginate is. Now we're going to fill up the empty side, the other side of the tray, with another 4 to 5 scoops of alginate, and you put it in there and you squeeze it together and tighten the screw down, and you'll see all the alginate squishes out, and you wait a couple of minutes till it's set, and we have a denture inside, and we tease the denture out, and now we have a mold for our denture. Now we take our ortho acrylic, and I like the clear acrylic for this. It just makes it easier. You can see what you're doing better. There's no reason to have color, but I suppose colored acrylic will work. And we take that and we mix up a fairly runny mixture of the ortho acrylic, and we put it into the mold that we've made for our denture. Now we're going to take that and put it on a vibrator to try to get out as much of the air bubbles as possible. But if there's a few air bubbles, it's really not that big a deal, because again, we're going to reline this when we're finished, and this is not a denture they're going to be wearing. So get as much of the air bubbles as you can get out, and then make sure you have enough of the material in. And then we're going to close the denture duplicator back down, tighten down the screw as much as you can, and now it's important to get that acrylic off before it sets. If you get the acrylic, let it set there, it can be hard to get this thing apart. So let that set and get the acrylic out of the way so it doesn't lock around the screw mechanism, and maybe save a piece of that acrylic so you can feel when it cools down and when it's hard. And when it's hard, we go ahead and take it apart, and now we have a clear duplicated denture of this patient's denture. As you can see, there's going to be a big fin around the edge where the two sides met, and then you just take an acrylic burr and smooth that up so it doesn't hurt the patient's lips and cheek, and get any rough edges that you have or any little voids that you might have that could hurt the patient. And then we're going to knock out the undercuts, and this should be familiar to any of you dentists who do denture relines. You want to knock out the undercuts so that the denture won't lock on the model when they pour it up to the lab. If you don't do this, they'll pour up the denture, and the lab will pour up the model rather into the denture, and they won't be able to get this off because it's locked on the undercut. So just knock out any of the large undercuts. Here's what we have. And again, you can probably do this in about a half hour if you're fast at it. You might want to schedule 45 minutes the first time that you do it. Now we go into the patient's mouth, and this is what we hopefully all learned in dental school. We look in this particular case, the denture is a little bit overextended, and we want to make sure that it's not, so that when we take our impression, we can roll those borders. And oftentimes we'll do this, and this is going to fit better than the patient's existing denture. So we get the borders cut back, make room. Once it's fitting well, we go ahead and put our holes in for retention, and at this point sometimes we'll take green stick compound if we don't feel we're going to get adequate retention, and we can make your post dam like you would if you want to do that. I typically do that before I put the holes in. In this case, I didn't feel like it was necessary, so we go ahead and put some retentive holes with a 8-round burr. And then you're going to put some adhesive on the denture so that our light body polyvinyl wash will adhere, and make sure we wrap it around the borders so it doesn't peel off as we border mold. And then we're going to fill the tray with some light body material. I have the patient gently bite down into occlusion. Again, it's really the occlusion's not near as critical as if we were relining a denture. And then we do our typical border molding. And then you're going to trim it up with I use a 15 Bard Parker blade, and we end up with a nice relined denture. Then from here, we just place that back into the mouth, and we use it just like the teeth. And we go ahead and use our George gauge, get a range of motion, decide on where we're going to take our bite, and take our George gauge bite or pro gauge or whatever type of gauge that you might want to use. And we send it to the lab, and certain labs do this a little better than others. So if you want more information, feel free to contact us at Dental Sleep Solutions, and we can point you in the right direction as to which labs have a little more experience at doing this. But they'll send it back, a dorsal design in this case, and I've also done recently 3 or 4 herps that have worked quite well as well. And we have a device that looks like this, and typically we put it in and we treat it very similar to a regular mandibular advancement device. You can see this particular one has the hooks for elastics. You can sometimes even still use those. Sometimes you may not be able to, depending on the retention that you get. And the advantage to this is that we end up with a denture that fits to the ridge, and if there's any pressure, a lot of times in the inferior direction, especially on the buccal ridge, we can feel free to adjust this device so that it fits comfortably. If we made this directly over the denture, then we would have more difficulties. We wouldn't want to adjust the patient's denture because we could knock down the retention on it. So there you have it. That's a simple trick that I think, or a tool to use for your edentulous upper patients. And we hope you enjoyed this from Dental Sleep Medicine Insider magazine, Dental Sleep Solutions, and your DS3 implementation system.